Okay. Hi, class. My name is Sara Lyles. This is my presentation titled Medication or Healing. What do I do? Okay. According to the Anxiety and Depression Association of America, 1 in 6 people in America currently take a psychiatric drug to treat their symptoms of depression or anxiety. Anxiety and depression usually go hand in hand. Someone who suffers from anxiety usually also eventually experiences depression, and likewise. Um, therefore, anxiety and depression are in demand for treatment. Um, Common treatment methods are that the physician usually presses prescription medication. Um, it seems to be the norm for society. Uh, You can see TV commercials all the time, also pushing medication for commercials showing anxiety and depression. So, uh, let's see, they'll usually say, has your medication stopped working? So, take this in place of that because it's not working or it stopped working. Um, and now, a lot of times, they'll say, take this along with your current medication to increase the results, also suggesting that that medication is not working. So, a mainline treatment options. So, if you go to an ER visit, an ER setting, and you have a panic attack, um, after the doctors eliminate any serious health conditions, um, and they determine that it's just a panic or anxiety attack, they'll usually prescribe you a Xanax or any other sedative type medication. And basically, these just repress your nervous system, and they sometimes create a sense of a mild high. Um, so the whole point is to increase the sensation of calmness by suppressing your physical and mental sense of panic, stress related. Okay. So, say you go to the doctor's office with stress related symptoms. So, say something like you're having chest tightness or heart palpitations or other symptoms of anxiety. Um, of course, after the doctor eliminates any serious health concerns, they may ask, how is your levels of stress? Like, what do you do to handle stress? Are you stressed out? And so, if you reply with anything suggesting a concerning level of emotional stress, um, a general doctor can prescribe you Zoloft or another antidepressant. Um, so, basically, what those do is they alter the chemicals in your brain, which are responsible for mood. So, um, they're kind of giving you an artificial sense of mood. So they are usually unlikely to encourage a visit to a mental health specialist, but they will write you a prescription that has a certain amount of refills. Um, so you just maintain that medication. So, um, why is this an issue? And uh, I feel that physicians and society have normalized the diagnosis of depression and anxiety, and the treatment option being medication. They treat it like it's a common visit to a doctor, like somebody who sprained their ankle, or if you have the flu, you know, um, it's a normal now to have anxiety or depression and just write it off with a prescription. Um, so, by doing this, it teaches the general population and our youth that something can be or is wrong with them and that they do need medication to resolve this issue. So, um, hmm, okay, so creates a sense of helplessness. It enables a helpless mindset by teaching people that medications are necessary to treat whatever's going on with them. And it also suggests a degree of what's wrong. So back to it, teaching the population that something is or can be wrong with them. People may feel sad and they're like, oh, well, I'm depressed. And, or they'll let a doctor say, um, yeah, it sounds like you're depressed. Here's an antidepressant. Um, so maybe you didn't even have that degree of something wrong. You just, you feeling the blues. So um, basically, with all that being said, um, the patient doesn't get to learn any coping or management skills for their symptoms. They rely on the medication. So instead of learning what causes these anxiety attacks or this feelings of depression, whether it's life events that are happening or maybe they're just way more stressed than they realize, they'll take a pill which ultimately just masks the symptoms. And in other words, they're putting a band-aid over an infected wound. So it basically creates a chemical dependency. So in the morning, they're like, oh, I don't want to have another anxiety attack. Better take my pills, or if they feel the onset of something, they take their pills. So it just creates a relationship with that medication where they're reliant on it for the relief of what they're feeling. And it keeps their mind having a doomed state of mind if they don't have the pills, then which also adds to their sense of panic. They're like, oh no, what am I going to do without my pills? So assuming that the patient doesn't have a clinical degree of depression, this just makes their situation worse. um, oh, Jumped ahead. So another issue would be that an actual allergic reaction to antidepressants is increased depression symptoms, possibly even suicidal thoughts. So back to what I just said, assuming that the patient doesn't actually have a clinical degree of depression, that just makes their situation all the way worse. If they're just feeling kind of sad, and they take these antidepressants, it could cause them to actually become depressed or have suicidal thoughts. So, um, what do we do? Well, we can tend to the psychological wound. Um, we can encourage the patient to visit a mental health professional, to learn other ways to deal with what's going on with them. We can educate them on alternate ways to manage their symptoms, something such as counseling, which usually brings awareness, healing, and how to maintain themselves. Therapy is an idea. It brings healing and recovery and maintenance. Coaching, and you get some life coaching that helps with recovery. It gives you a sense of purpose. It helps you develop a sense of purpose and, maintenance over yourself. And then a spiritual attunement, it develops a sense of healing, growing, and purpose. So, um, spirituality comes in different forms. It's not just religious based. So you could do things like meditation and relaxation techniques, which will help to calm the mind and the soul. You could do praise and worship suggestions, depending on their belief system, or maybe just the power of the universe and helping them recognize what they do have control over, but it helps them understand the freedom of surrendering and what it feels like to just think differently, learn that you don't have to be in control all the time. Um, you could teach them about journaling and prayer, um, that gives them attention to the depth of their personal truths. So there's a lot of ways to tend to yourself, to mend and to heal, which all contribute to healing. These all will help create a sense of enlightenment, self-awareness, independence, empowerment, improved confidence, and overall healing. So my research question would be, can the addition of therapy, cognitive behavioral therapy, psychotherapy, mental health counseling, coaching, and or spiritual advisory reduce or eliminate the use of medications taken by a person experiencing depression and panic or anxiety symptoms, not diagnosed with a clinical degree of illness? Um, it's important that, I'm referring to people, everyday people, not somebody with a specific history of mental illness. So we can start with the general population first. The null hypothesis is that there is no improvement of one's sense of well-being with either therapy or spiritual advisory exposure. The alternate hypothesis is that either therapy or spiritual advisory has a direct effect on one's sense of well-being for the better. Okay, so some of the studies that I reviewed, these are some of the summaries of them. So therapy treatment for participants along with a prescription pill and the same therapy treatment using a placebo pill produced a positive response to the treatment regimens in both the placebo and the prescription pill takers. So this demonstrates the power of the mind and believing what we think or are told. Okay. Um, the increase of spiritual development is in depressed people has a direct correlation with their ability to experience a greater sense of hope, peace, confidence, and clarity, increasing the awareness of their symptoms subsiding. So this plays into a person's sense of purpose and a person's sense of peace. If we can get away from the focus on ourselves, acknowledging that everything is much bigger than us, for example, finding something to believe in, something that inspires or motivates us, it gives us a reason to desire something more. It creates a sense of fulfillment or a sense of purpose. Okay, so another study um, referring to our youth. So they incorporated mental health awareness slash spiritual development into the schooling systems in high school age kids. They engaged the students in thought-provoking group sessions regarding feelings, mindset, aspirations, insight of self and behaviors, and implemental biblical readings and studies. This showed to help students with the transition into adulthood and to become more aware of the importance of taking care of their self mentally and spiritually. This also helped them learn ways to practice self-control and ways to recenter themselves when facing stress or hard times. Um, so this demonstrates that placing attention on mindset and accountability can add to our youth's general sense of morals and values. Methods and data collection. Um, so I'll be doing a 6-week study. There will be 15 adults who have all been diagnosed with experiencing both depression and anxiety symptoms and have been prescribed and are currently using a medication as their treatment regimen. Um, this will be adults who are not clinically diagnosed, but were given a diagnosis and prescription by the ER doctor or a general doctor. Um, so they'll take a survey at the intake, and it's going to go into ask them a little bit about their diagnosis experience, if they were educated on other options, and what they prefer as a form of treatment. Um, okay, they're going to be divided into 3 groups of 5 people per group. Group 1, which is the control group, will be the pill regimen only. Group 2, which is an experimental group, will do 1 2-hour therapy session per week along with their pill regimen. And group 3 will also an experimental group. One will also do a 1 2-hour spiritual attunement session per week along with their regular pill regimen. Mm. Methods, data collection. Okay, so basically, at the end of each week, uh, they're going to do they're going to participate in an interval scale survey, which has the choices of agree and disagree. So it's going to ask them about their general mood, their emotional state, their feelings, and their mindset, um, their presence of depression and anxiety symptoms, etc. I'm going to use quantitative data. I'm going to analyze the information using an F test between subjects one way ANOVA, followed by a post hoc test. Okay, so hypothetically, I will find that the pill regimen alone produces a positive response. I will also find that therapy and the pill regimen produce an increased positive response. Um, and I will also find that spiritual attunement and the pill regimen produce an increased positive response. So, hypothetically, um, the survey will reveal that at the time of diagnosis, participants were not urged to pursue therapy or counseling. Uh, at the time of diagnosis, participants were not informed of what may be causing their symptoms. Participants would have considered alternate treatments or the inclusion of alternate treatments if they knew of other options. Um, so participants did consider counseling, hypothetically, for deeply troubled people, or considered spiritually religion based, a stigma that needs to be defied. So basically, the stigma is that counseling is for crazy people, um, not realizing that spirit, and they also don't realize that spirituality does not have to be religion oriented for non religious people, or those who have felt rejected by their religion for one reason or another. You know, some people don't, they're just completely disconnected from their spiritual selves because they think that it's about religion, and it's not. So, um, and hypothetically, we'll find that there is a desire to reduce the use of prescription pills as a means to deal. So, to conclude, I will reject the null hypothesis, which concludes that therapy, guidance, or spiritual advisory does influence one's sense of well being for the better. So, after the 6-week trial of therapy or spiritual attunement, um, hypothetically, participants will become more motivated to tend to what's causing their symptoms, or at least learn better ways to manage their symptoms. Um, so, to a greater degree of explanation, by nurturing your personal power, including the realization that you do have a choice between healing or maintaining, you not only prosper mentally and spiritually by gaining empowerment, but you are further equipped to combat the daily stressors that can lead to anxiety and depression symptoms. So, for future research, the lack of education, information, and options disempowers people from making an informed decision. A big thing is that they're not educated at the time of diagnosis, both in regards to the medication they're given and other treatment options. Um, and, you know, most of these people, especially, yeah, most people suffering from either depression or anxiety symptoms are at a desperate place. They're seeking relief. So they just trust the diagnosing physician, and they accept that this is a new part of their life because they want the relief, and the doctor knows best. So they don't, you know, and now we're enabling that um, helpless mindset of this is happening to me, you know. So, some things to consider and look further into would be: will education of alternate treatment options in a physician's office increase the desire and choice of a person to personally heal versus managing a relationship with prescription medication? Okay. And could the inclusion of mental health oriented courses in our schooling system, such as like PE classes, music classes, art classes, um, could this alter the general attitude towards mental health and not only relinquish the stigma, but enable a person to recognize and tend to a psychological wound. So, if we educate people, if we take mental health more seriously and treat it like physical health, things that, if you had a bleeding arm, you wouldn't just be like, oh, well, some people do, but, it's the same thing with our emotional self and what's going on with us mentally. We need to address it. So, um, so another thing clinically, uh, with the appropriate supervision, how would the result differ if a placebo replaced the pill regimen in the study I want to do, assuming it's a safe option, depending on the participants' reliance level on the medication that they're taking? As long as we have the appropriate supervision, how different would it be if we gave them a placebo instead? The end. Thanks for tuning in. Sorry it took so much time. Hope you enjoyed.